Hi, Brianna. Um, I thought you did a great job on your discussion post about syphilis. That's a STD that a lot of people don't really talk about. I guess it's not as common as other diseases. Um, the scary thing about syphilis is if you don't get the symptoms that are visible, a lot of people won't know that they have it, and then you end up with that like longer syphilis, secondary and tertiary syphilis, which like makes you have all those neurological problems, and they call it neurosyphilis. It causes severe headaches, muscle weakness, trouble with your muscles, can paralyze you. But the thing about it that scares me the most is how it causes personality changes, along with the memory loss and dementia. It's particularly scary about that because, like, you could be like 50 years old and be to the naked eye like perfectly healthy, and then you end up starting to be confused and acting irrational and lashing out on family members and friends. And you go to the doctor, you're trying to figure out what's going on, and then they ask you if you ever had syphilis before, any STDs, and you say, well, I never had syphilis, but I had this and that. And then they test you for syphilis, and now you're like basically dying from something that you caught 30 years ago because of the ability for syphilis to go into the latent phase, which is when you don't have any visible symptoms and it's still in your body, waiting to become that really bad third stage syphilis. I think the most common sign for syphilis is the swollen lymph nodes and the chancre sores. Um, Chancre sores are the nastiest looking things I have ever seen in my life, um, and I don't know, it's just disgusting. I think the sad part about all of this is that um, you have the easiest way to treat this is such an easy way. You take a penicillin. All you do is take a penicillin, and you can avoid all of those symptoms from the latent phase. But people don't. You talked about it. People do not get screened for syphilis, like especially not men. They screen for women if you get pregnant. But if you don't get pregnant, they don't screen you for that unless they have a reason to think that you might have it. You don't really get screened for syphilis like that. You said something about a rapid syphilis test. I never even heard of them having a rapid test for syphilis. I've always known about the blood test that you have to have, and it takes days to come back. Um, you also mentioned that Cuba um, figured out a way to eliminate transvaginal transmission um, from mama to baby, and it just makes you wonder how we are like the strongest country in the world, have all these technological advances, but we can't figure out how to eliminate these STDs and even things such as cancer. It just makes you wonder if people choose not to do it. Cuba's a really small country. You would think if they were going to come up, we would have came up with it first if we wanted to. But anyway, I think that the World Health Organization has the right idea about expanding access to healthcare for STDs. But the thing about it is I don't even think it's a lack of access to healthcare for STDs. I think it's more of a shame that is affiliated with having STDs, so people won't get tested for it because they don't want to know. And most people don't get tested for it unless they have symptoms and they're walking around miserable, so they have no choice. Anyway, thanks for joining my TED Talk.